Welcome, folks. In the midst of all this brouhaha about who told the Russians what and who lied to whom and who ordered wiretaps, Kim Jong-un has decided he wants to play nasty over in the Far East. He launched a trio of missiles into the Sea of Japan, close into Japanese waters. And the reason he was doing it was to test the mechanism and the control mechanisms for these launches, looking to have a missile with a warhead capable of hitting Japan and ultimately America. That's what he says. He says, we're going to get you, and he's giving us warning. So what is Trump going to do? And I wish the people in Washington would get their minds off this nonsense that they're involved in and look at some of the threats facing us as Americans. However, I am pleased to report the Republicans have come up with a very significant step toward fulfilling one of the president's biggest campaign promises by introducing a new plan to repeal and replace Obamacare. And Republican leaders believe that certainly in the House they can get the votes to pass it.
Well, even so, that plan is going to face roadblocks in Congress. Democrats quickly attacked it, as expected, and critics, including some conservatives, have questions about it. Charlene Aaron has the story.
Last week, President Trump called on Congress to take action on Obamacare.
I am calling on all Democrats and Republicans in Congress to work with us to save Americans from this imploding Obamacare disaster.
The House plan is called the American Health Care Act. Two of the House Republicans behind it, including Ways and Means Chairman Kevin Brady, say in a piece in the Wall Street Journal today that it will rescue those hurt by Obamacare's failures and lay the groundwork for a patient-centered health care system. Our fiscally responsible plan will lower costs for patients and begin returning control from Washington back to the states. The bill will improve access to care and restore the free market, increasing innovation, competition, and choice. The plan gets rid of some of the most unpopular parts of Obamacare, like trying to force people to buy health care insurance even if they don't want to. The measure also eliminates Obamacare's taxes. And it blocks taxpayer money from going to Planned Parenthood for a year. The bill gets rid of Obamacare's government subsidies for health insurance. It replaces them with federal tax credits to help people buy insurance. The plan also expands contributions to health savings accounts, and it forbids tax credits for any plan that covers abortion. The bill keeps a couple popular parts of Obamacare, like letting young adults stay on their parents' plans until they're 26, and protecting people with pre-existing conditions. But there are still many questions about the plan, including how many people may lose insurance from Obamacare and how much it will cost. The Congressional Budget Office hasn't estimated that yet.
And many Republicans have questions about parts of the plan, and Democrats will oppose it because they don't want to get rid of Obamacare. But Obamacare has been unpopular in the polls for several years.
And even former President Clinton blasted it on the campaign trail last year.
So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
The plan is likely to be a starting point for discussion on replacing Obamacare, and it may take a while. It took the Democrats over a year to pass Obama's health care plan in 2009 and 2010. But Republicans are clearly determined to push ahead so they can then move on to their next big goal for this year, reforming the tax code and cutting taxes for businesses and individuals. Charlene Aaron, CBN News.
You remember the president, if you like your doctor, you can keep him. That was a lie. If you like your health provider, you can keep it. That was a lie. He went around and he sold this thing with just nothing but lies. They lied a lot. And not one Republican joined in voting for that thing. It was jammed through by a Democrat majority in the Congress, and no Republican was asked to participate. Now it's time to change it, and it's time, I might add, for the Democrats to get on board. What was there is they were trying to force younger workers into a plan that they didn't want, and they were putting stuff on that only applied to elderly people. And the guys at 26, 7, and 8, and 9, and 30, and so forth said, we don't need this stuff. Why should we buy it? And so the exchanges were going broke. All around the country, they're going broke. And they point out to that thing out in Arizona where the premiums have gone up over 100%. I mean, it's just crazy what's been done, and this thing has got to go. And so if the Democrats want to have a last-ditch battle and say, we'll hold on to this fading ship, the ship is going down, but we'll go down with it, well, good for them. But it's time the Republicans say, we cannot stand it any longer. It's got to be changed, and it's got to be repealed. They can't do Obama light. They've got to get rid of it and then put it in. And this is a patient-centered deal, so you can have it. It's portable. You can go from state to state. That's good. And you've got a kid at home, say a kid 26, he can stay on your policy until he gets to be 26. That's okay. If you're having difficulty paying your premiums, they were taking Medicare and Medicaid to do that. I think they'll still have to have some kind of a subsidy, and they cannot just dump a whole bunch of people. It'll be an outcry of massive proportions. So if people are, you know, on the other program, they have to have a legitimate transition period. Then they're going to have health savings accounts, which are wonderful things. They'll double the amount that could be put into health savings accounts. So it's a patient-centered, free market type of program that can commend itself to the thinking people in America. But the Democrats will scream and yell, and we're sick of that screaming and yelling. It's time to stop and get on with it. Let's do something good for America. Okay, now the president has also signed a second executive order on immigration. It's intended to keep out possible terrorists. It is not a, quote, anti-Muslim ban, and I'll point out one more time. It does not include the largest Muslim country in the world, which is Indonesia, nor does it include Egypt, which is probably the second largest, nor does it include Pakistan. They're all these countries. What is included in here are failed states where the government is unable to vet any of their people and give a satisfactory answer. So it means extreme vetting. It means that people from those countries are going to have to be vetted. And I might say the ACLU is already bringing lawsuits, and they're claiming it is a violation of the, quote, Establishment of Religion clause of the Constitution. The American Center for Law and Justice is going into court every time they do and coming up with an amicus brief against them. The Justice Department will also fight them, but the American Center for Law and Justice will have the answers to this nonsense that this somehow establishes religion to keep people from Yemen from coming into this country. This is just insane, but that we're dealing in a world of insanity. Well, John Jessup has more about this whole story. John.
Pat, the president's White House executive order also loosens language on providing help for Christian refugees, and it's written to withstand a legal challenge in the courts. The move comes as the administration is also taking on a major foreign policy challenge. White House correspondent Jennifer Wishon brings us that story.
The White House is hitting the reset button after the president's first immigration order was shut down by a panel of judges. This time, there was no fanfare, no big bill signing. Instead, the cabinet secretaries responsible for carrying it out handled the details. Attorney General Jeff Sessions says, like the first executive order, it's perfectly legal.
This executive order responsibly provides a needed pause. We can carefully review how we scrutinize people coming here from these countries of concern.
Travelers from Iran, Libya, Somalia, Sudan, Syria, and Yemen are banned from entering the country for 90 days. Iraq, which was included in the first order, has been removed after the country made improvements to its vetting system. People traveling for medical care or foreign nationals working for the U.S. government are free to enter the country. The rollout is delayed until March 16th to give travelers and agencies a chance to comply and to appease the courts.
We cannot risk the prospect of malevolent actors using our immigration system to take American lives.
So what about Christians and other religious minorities facing persecution? Instead of giving them priority, the Departments of State and Homeland Security have been given the power to grant waivers if being denied status as a refugee would cause someone undue hardship, like Christians and others facing genocide at the hands of ISIS. Despite the administration's efforts, the new order could face challenges from opponents. Meanwhile, the White House isn't saying much about President Trump's charge that former President Obama wiretapped Trump Tower. They say they're waiting for the House and Senate Intelligence Committees to begin their investigations.
He would ask that they additionally look into this issue of leaks of classified and other information coming from the government. He believes that it undermines our national security.
And the president is also dealing with a major test in foreign policy, the growing threat of North Korea. During the nation's ballistic missile test this weekend, 3 of the missiles landed in Japanese waters.
Imagine someday one of these North Korean missiles accidentally doesn't stop in the Sea of Japan, but accidentally detonates or hits somewhere in Japan. I can tell you Japan would respond. Imagine if the same thing happened in South Korea. South Korea would respond. And we're talking about nuclear weapons being possibly introduced to this.
Of course, both of those countries are U.S. allies.
Absolutely. So that would draw the United States into any conflict.
Harry Kazianis with the Center for the National Interest expects to see North Korea launch more missiles more frequently as it works to strengthen its offensive capabilities.
North Korea, for example, could put biological weapons. They could put chemical weapons. They could even get some crude radioactive material and stick it on a missile and lob it at the United States. That would have a very, very, very scary effect on the United States, its allies. So it doesn't have to be a nuclear weapon.
He says Kim Jong-un knows the U.S. won't invade his country as long as he has nuclear capabilities. The Trump administration is considering tougher sanctions, even resuming stalled negotiations to combat North Korea's aggressions. And the Wall Street Journal reports a White House review of strategy includes the possibility of using military force or regime change against the North to blunt its nuclear threat. Last week, a senior White House official called North Korea the greatest threat facing the U.S. Jennifer Wishon, CBN News, the White House.
Thanks, Jennifer. The number of new babies hit a record low in Italy last year, according to a report by Reuters citing government statistics. 2016 saw the lowest level of births since the unification of Italy in 1861, and it's not the only European country facing demographic shifts. The New York Times reported officials in Denmark have been so concerned that they offered sex education classes focused on having babies rather than birth control. And Spain recently appointed a sex czar to encourage having more children. And Pat, other European countries like Germany have also faced serious low birth rates.
You know, I've been monitoring this for some years. The whole thing is the number of people in the world. Say there's 6 billion people in the world, and Europe's percentage of those people used to be about, I'll say 30%. Which gave them a significant voice. All right, now we've got over 7 billion people in the world, and Europe's population, instead of increasing, is diminishing. So their percentage of the people in the world has dropped from like 30% down to probably less than 10%. I don't have the exact statistics. I asked for that, but I wasn't able to get them here by this program. But the idea is, it's a tiny, tiny minority, which means that the influence of Europe in the world is no more than South Korea or North Korea or, well, certainly not India or China, which have got huge populations. So they're trying now. They've been told the thing to do is to let women work, don't have babies, use birth control, and abort babies recklessly. Well, we've done that here in America. The thing that's keeping America going is the enormous amount of influx of immigrants. If it weren't for the immigrants, America would be in the same plight as Europe, because you have the maintenance is about, what, two births per 1,000 women or whatever it is. I mean, it's whatever that number is. And when it begins to fall below that, the replacement rate, then your population begins to shrink. It doesn't shrink in America because of immigration. We've had a lot of immigrants. So it's demographics, folks, demographics. And the thing that is shifting here in America demographically and in Japan and other the countries are getting older. So if you don't have babies coming along, then the percentage of the young diminishes and the percentage of the old grows. And the old people need more health care. They want to retire. They need more social services, et cetera, et cetera, et cetera. So the percentage of our population over 80 is growing at faster than any other percentage. Now, if that bores you, I'm sorry, but that's the way it is.
It may bore you, but it will affect you.
It's going to affect the daylights out of you. But when I talked about this years ago, I was laughed at by some of the liberals. Oh, who do you think a woman's womb is part of the national, apparatus? No, I don't think that. But if you start killing babies and you figure how many of them got slaughtered, and we've killed. How many babies have we killed now? 50 million? 60? No, 60. It's over 60, isn't it? 60 million?
I think so.
Much worse than the Holocaust. Much worse than anything we've ever heard. The slaughter of the young here in America has been shocking. And think of all those people, all the wonderful things they could do. They could be writing symphonies. They could be writing plays. They could be inventing new ways of doing things. They could be founding businesses. They could do all these things. But they won't be there because they're all gone. That's what unlimited abortion has done. And were it not for immigrants, we would be in the same condition as Europe. So, did I talk too much?
No, but it's that's the broad look at things
That's
that
right.
people sometimes don't think about. We get a very narrow day-to-day perspective.
Europe is no longer significant because demographically they no longer are significant. And you've got the rise of China, you've got the rise of India, you've got the rise of these Muslim countries. They're all much, much bigger and much more significant now on the world stage than Europe is. Okay.
Seriously.